Hi guys, my name is Charles and I'm one of the surgeons at Southpaws. Today I'm going to talk to you about a case that we operated on last week that had pericardial effusion. The pericardial effusion recurred 3 times despite draining, and we did a CT scan and an ultrasound which revealed no evidence of a mass anywhere in the right auricle or anywhere else. So in this video I'm going to review what we did thoracoscopically. Now with thoracoscopic surgery, what we do is we put cameras into the chest and we use long instruments to perform whatever manipulations we need to do while we're in there. So what was really exciting about this case was that we used a brand new 3D laparoscope, which gives us excellent depth perception and increases the safety of the procedure because we don't have to constantly distance seek for our different instruments and for the different structures within the chest.
So this image shows the port position for thoracoscopic surgery. And here we're performing a complete exploration of the thoracic cavity, and we can see foam that's developed from the accumulation of pleural fluid due to the pericardial effusion. At this point, we're perforating the mediastinum from the contralateral side of the chest so that we can start the thoracoscopic pericardectomy. We extend the division of the mediastinum cranially until we get to the point of the internal thoracic artery. Here we're using the laparoscopic or thoracoscopic Metzenbaum scissors to make our initial perforation in the pericardial sac. We use the monopolar electric artery to continue the creation of the window in the pericardial sac. And you can see that we've removed the majority of the ventral aspect of the pericardial sac using a combination of monopolar electric artery as well as our ligature unit. Note that we are removing the pericardial sac dorsally to the level of the phrenic nerves, leaving those intact so as not to affect respiration.
As always, if you haven't already done so, please subscribe to our channel and don't forget to turn on your notifications so that when we do live stream surgeries, you'll be able to get a little ping on your phone that'll tell you when we're up and running.
Now this is our patient Roger just 2 hours after his thoracoscopic pericardectomy. And if you imagine a dog that had had a midline sternotomy, he would certainly not be in this good a condition. At Southpaws, we really believe that minimally invasive surgery should be the standard of care, just like it is in human medicine.